Hello everyone, hope you're all staying safe and healthy during these crazy times. Today I'm going to be discussing some more topics on facelifts, especially pertaining to male facelifts. I'm out here in my Long Island office just catching up with admin work today, and so I'm going to do a little video about this. About 20% of my patients are males, and that encompasses both surgical and non-surgical. A question that I get asked frequently is, what is the best age for a facelift? My answer usually is if you're a medical candidate and you're otherwise healthy, and if you have areas that bother you in your lower face and neck, then yes, you're a candidate for a facelift. So age really isn't a factor. So today I'm going to be discussing a male. He's 77 years old. He was not happy with his lower face area and his neck. You can see over this, got a lot of extra skin and the sagging in the lower face and neck. So what we did for him was a deep plane face and neck lift. He also didn't want to go under general anesthesia or even do IV sedation because he was afraid about the side effects for anesthesia, given his age. So he's otherwise healthy, but he wants to maximize his recovery and minimize his risks. So we did the procedure on local anesthesia, and we gave him oral medicines to relax him. The jawline is much more defined, and you can see his neck. You can even see his Adam's apple now that you weren't able to see before. Most importantly, all the extra jowling and neck laxity that he has down there is all cleaned up. His jawline is contoured, his neck is contoured. He's very happy. If you have any questions about facelifts or any other surgical consults, we're still open and doing consultations. We can be reached at both numbers, in the New York City number, which is the 212-203-8591, or the Long Island number, which is 516-226-1080. We're doing lots of virtual consultations, so feel free to call us, schedule, and then we can go from there.